Welcome to the Healthcare Authority's Interpreter Services Sign Language Program Claims Training for DES ODHH contractors. This training is designed to teach you how to submit a claim into ProviderOne. When you have completed this training, you will have the tools and knowledge to successfully submit a claim into ProviderOne. You will be able to understand when to use a special claim indicator code and learn what a TCN is and why it is so important to you. Let's get started. Before you begin using ProviderOne, it is important to make sure your computer is ready. You will need to be working on one of the supported operating systems and using a compatible internet browser. Also, don't forget to turn off any pop-up blockers. They can prevent key features of the system from working properly. Now that you've confirmed you're using the correct browser, it is time to log into ProviderOne. You will need to use your individual login credentials. That means your domain name, which should have been provided to you after you completed your system setup with the ProviderOne Security Department, and of course your password. Make sure you have both pieces of information handy before moving forward. After you've successfully logged into ProviderOne, the next step is to select your profile. In most cases, your profile will be labeled EXT Provider Super User. Once you've selected the correct profile, select the Go button to continue. Once you select the Go button, you will be taken to the ProviderOne menu. From here, look for the section labeled Claims. In that section, select the third option down, Online Claims Entry. This is a hyperlink, and selecting it will take you to the next page. Once you are on this screen, you will want to choose the first option, Submit Professional Hyperlink. Selecting this will advance you to the Claims Entry page, where you can begin filling out the claim form. Now that you are in the claim entry screen, you will begin filling out the required fields. Start with the section labeled Billing Provider Information. This is where you will enter your NPI number and the program taxonomy code. For sign language providers, the taxonomy code you will always use is 171R00000X. That's right, 5 zeros. This code is important. It tells the system you are authorized to bill for sign language interpreting services. Without it, the system won't recognize you as a sign language contractor and your claim will be denied. You also need to answer two key questions. First, is the billing provider also the rendering provider? The answer is yes. You are the one providing the interpreting services that you are billing for. Second, is the services a result of a referral? The answer is no. Next, you will move to the Subscriber Client Information section of the claim screen. This is where you will enter details about the client who had the appointment. Start by entering the client's ProviderOne ID number, followed by a WA. Then, you will need to select the red plus sign to expand the additional subscriber or client information section. This will open up more fields where you'll enter additional required information about the client. We will walk through those fields in the next slide. In this section, you're required to enter the client's last name, date of birth, and gender. These fields are mandatory and must be completed for the claim to move forward. You will notice a final row with fields for date of death, weight, and the pregnancy question. You can skip these. These are not required for sign language interpreter claims. Here, you see a preview of the claim information section. In the next slide, we'll explore each section step by step to help you understand every detail clearly. To add a prior authorization reference number, tap the red plus sign. This expands the prior authorization section. Then, type the reference number into the field provided. Remember, it is important. If this number is missing, your claim will deny, and you will have to rebill and include the prior authorization number. The ProviderOne claim system is designed to catch and stop duplicate claims. However, in sign language, some situations might look like duplicates, even when they are not. For example, a same-day appointment for the same client ID, or multiple lines from an interpreting team that seem similar, like 2 lines of T1013. If your claim is not a duplicate, add a bypass code in the claims note. This tells the system the billing is correct and intentional, and it helps prevent delays in payment. To add a bypass code, select the red expander next to the claim note. In the type code field, select the ADD Additional Information dropdown. In the notes field, you will enter a bypass code of SCI equals RI with no spaces. You can ignore or skip over the remaining red expanders in this section: EPSDT information, condition information, and additional claim data. These are not required for sign language claims. When you see this question, is the claim accident related? The answer is always no. That is because services provided by Medicaid would never be related to an accident. If the client has an appointment related to an accident, they could be covered through an auto insurance or labor and industries. Our program only covers outpatient pre-scheduled services for eligible Apple Health clients and contracted providers. The patient account number field is optional. You can use it to enter your own internal tracking number or the service request number you received from an ODHH request. Next, select the place of service. This refers to where the interpreting happened. For example, in an office, via telehealth, or another location. This field is required, but don't worry, it does not affect payment. For sign language claims, the diagnosis code is always Z710. You only need to enter one diagnosis code, and it must go in box 1. It's important to remember that you will not include decimal points. Enter it exactly as is, Z710. Now, let's move into the basic line item information section. On this screen, you will see a preview of what that looks like. In the next few slides, we will break it down step by step, starting from the top and working our way down. Keep in mind, each service line will have 6 requirements: date of service, procedure code, modifiers, pricing associated with procedure code, units, and diagnosis pointer. The date the interpreting took place is the to and from service date. Be sure to enter them in the required format: month, day, century, and year. You do not need to select the place of service, as this was done previously at the claim level section. Procedure codes identify the type of services you are billing for. This could include the interpreter's time, an agency's finder's fee, mileage, or other approved travel activities. Each code has a set fee in the ProviderOne system. By entering the correct procedure code, you are telling ProviderOne exactly how to reimburse you. Modifiers must be used for all sign language billing. The first modifier will always be U3. U3 is the code that identifies sign language. You may add a U8 or a U9 for behavioral health or substance use disorders if it applies. U8 and U9 modifiers should only be used along with a T1013 procedure code. If the appointment is a last-minute cancellation or a client no-show, you will use the modifier 52. Keep in mind the modifier 52 will always be the last modifier used. When entering your submitted charges, make sure you enter the amount for each procedure code, not the total for the whole claim. Each service line should show its own charges with the exact dollar amount, including the decimal point. Once all service lines are filled in, the system will automatically calculate the total. Next, under the Diagnosis Pointer section, select the number 1 from the drop-down menu. This tells the system to reference the diagnosis code we entered earlier. When entering units on the service line, you are entering quantity for each procedure code. For sign language interpreting time, 1 unit equals 15 minutes of interpreting or travel time. For mileage, 1 unit equals 1 mile traveled. Agency finder's fees units are always 1 per service line. For example, if you have 2 interpreters, add a second service line with the finder's fee T2024 and enter 1 unit for that second fee. If you enter 2 units on 1 T2024 service line, the system will only pay for 1. All mileage claims for the same client and the same date of service, whether billed on multiple claims or on a single claim, that exceed 200 miles will be suspended by the system. If this happens, you should send an email to our interpreter services inbox with the claim number and request that the team review and release the claim for payment. Additional claim information is not required. The prior authorization number has already been entered above, so you do not need to duplicate that here. The Medicare crossover items, drug identification, prior authorization, and additional service line information can be skipped, as these are also not required fields for the sign language claims. When adding service lines, make sure you have filled in all the required fields: date of service, procedure code, modifiers, diagnosis pointer, charges, and units. Once you have double-checked that everything is correct, select the Add Service Line button. ProviderOne will then refresh the screen and bring you to the top of the claim form. If you need to add an additional service line before submitting your claim, you may do so by choosing the service hyperlink at the top of the page, which will direct you back to the basic service line item. You will then follow the steps previously mentioned. This slide shows an example of how a claim might look when billing for an interpreting team. Each interpreter has a separate line for their actual interpreting time. You will also see individual service lines for each interpreter's finder's fee, 1 line per interpreter. When you're ready to submit your claim, select the Submit Claim button. It is located in the top left header bar where you started the claim form. Once you select the button, a pop-up window will appear asking if you want to submit any backup documentation. In most cases, you do not need to attach anything. However, documentation is required for certain travel-related situations. To learn which cases require backup documentation, check out the Sign Language Contractor Guide, available on our website. After selecting Submit Claim, you will be routed to the Submitted Professional Claim Details page. This page shows a summary of your claim, including the claim number, also known as the TCN. Make sure to record this number. The TCN is your claim's unique identifier, and it is how you will track or troubleshoot the claim later. If you attached any documents, you will see them listed under the Attachment List section. Remember, attachments are only required in specific travel cases. Once everything looks correct, scroll down and select the Final Submit button in the bottom right corner. If you do not do this step, your claim cannot be processed and payment will not be received. Please provide any questions you have to our interpreter services inbox. Or, if our team has set up a consultation with you, please share your questions with the program manager you are working with. We hope this training has been helpful in getting you started with submitting claims into ProviderOne. We encourage you to bookmark this training and return to it anytime you need a quick reference. A list of additional resources is also available. You can find these resources and many more on our Interpreter Services Sign Language webpage. Thank you for your time, and we look forward to working with you.